Hi, welcome to my presentation. This is Nabil Saleh, a second year's master's counseling student. My presentation is about the effects of reading fiction and non-fiction on empathy, well-being, and pro-social behavior. So first, I'm going to talk about the relationship between empathy, well-being, and pro-social behavior. There is a consensus in research that pro-social behavior and well-being are interconnected, meaning that they both can influence each other. Participants who carried out acts of kindness experienced significantly higher scores on well-being compared to the control group in one study. In another study where they used money, participants who spent money on others experienced more happiness than those who spent the money on themselves. Empathy also plays a role in that relationship with pro-social behavior and well-being. In one study, when participants were primed to be more empathic, they carried out more supportive and more pro-social behaviors compared to the control group. Also, empathy affects an individual's decision to participate in pro-social behaviors such as volunteering, and in turn, volunteering and pro-social behavior influences well-being. Also, patients report that, as opposed to sympathy, empathy and compassion were more beneficial in healthcare contexts. So, considering this positive relationship between empathy, pro-social behavior, and well-being, and its effects on society as a whole, isn't it imperative to find ways and use every way possible to encourage this relationship? And in more specific contexts, empathy in healthcare, empathy is considered a critical quality for all health occupations, and patients' higher satisfaction and lower distress is correlated with health professionals' empathy levels. And more specifically, empathy in counseling. Empathy is regarded as a necessary component in numerous psychotherapeutic modalities. Some examples: person-centered therapy, as found by Rogers, is considered an essential component for therapy and is also a significant predictor for successful outcomes for clients in therapy. Heinz Kohut, also a prominent figure in the psychodynamic modality, has reported that it is inconceivable to understand clients' behaviors without the skill of empathy. And in modern research and meta-analyses, empathy is at least a moderately strong predictor of therapeutic outcomes. Also, I want to talk about counselors' well-being. So, empathy fatigue, also known as compassion fatigue, it can be a significant challenge, and it can be a result of counselors continuously exposed to clients who suffer from severe traumas and emotional difficulties. Empathy fatigue can also have a knock-on effect on health professionals' practices, as clients' and patients' well-being may also be affected to the therapist burnout. So if a therapist is burnt out, this can affect future clients as well, and not just the therapist themselves. And this is why self-care is a main ethical guideline principle for counselors, as a good practice guideline according to the British Association for Counselling and Psychotherapy and other associations as well. So this is the rationale and motivation behind our study. How can we promote this beautiful triangle of empathy, pro-social behavior, and well-being, considering that it is beneficial for society, but also beneficial for healthcare and therapists? So there is some research done on ways to promote well-being and empathy, such as different types of meditations or empathy workshops. However, little research was found on reading. Now, reading is interesting because, especially in fiction, it is hypothesized to have the element of emotional transportation, where the cost of empathy and empathy blocking is reduced. So I'll explain this a little more in detail. So in real life, watching or reading the news, reduction and blocking of empathy can occur. This is because we can initially empathize with victims, but when we are unable to help, then this comes at an emotional cost, and therefore we end up blocking or reducing our empathy as a way to emotionally protect ourselves. However, with reading some genres, such as fiction, it may be easier to empathize without the costs that reduce empathy. Since the characters are fictional and no one is in real danger or suffering, the reader can freely allow oneself to empathize and emotionally transport oneself while reading. These are the hypotheses for our study. In summary, we hypothesized that participants who read fiction for at least 10 minutes a day for 1 week will report an increased level of empathy, well-being, and pro-social behavior as opposed to participants who read non-fiction. We also hypothesized that participants who report reading more time will demonstrate higher levels of empathy, pro-social behavior, and well-being. So our study had 32 psychology students from Bangor University in North Wales. They were randomly assigned to either fiction or non-fiction group, and they were instructed to choose a book suitable to their allocation and read for at least 10 minutes over a week. Their empathy and pro-social behavior and well-being levels were all measured before and after the intervention. And these are the scales that we use to measure the participants' empathy, pro-social behavior, and well-being. We used the Toronto Empathy Questionnaire, the Pro-Social Behavior Scale for Adults Questionnaire, and the Warwick-Edinburgh Mental Well-Being Scale. And we made sure our study followed the ethical guidelines of the Bangor University Psychology Ethics Board. Information and details of the study were submitted to the Psychology Ethics Board of Bangor University and approved. Participants were given information on the purpose of the study at the beginning and a debrief at the end of the study. Also, participants were asked not to provide any details that would lead to their identity, such as their email or ID number. However, if any information was given by mistake, it was deleted after completing the study and before the computation of data analysis. And these are the results that we have found. There was no statistically significant differences in empathy, pro-social behavior, and well-being scores, as shown in the graphs in that order. And I'm going to talk more in detail about that in the discussion. We have also done some correlational analysis based on the participants' reports of their daily reading habits. Keep in mind, these reports are based on the participants' daily reading habits prior to the study. And what we found is that there is a strong positive correlation between average well-being scores and reading fiction, meaning that participants who reported that they prefer reading fiction have higher overall well-being scores. There is also another finding regarding the empathy scores and time spent reading, which is also based on the participants' reports of their daily reading habits. And what we found is that there is no significant correlation between empathy scores and time spent reading among all participants, which also includes participants who reported that they do not read in their daily life or they only read when it's necessary. However, among participants who reported that they read daily, we found a statistically significant positive correlation between empathy and time spent reading. And this finding was more pronounced among participants who reported that they prefer reading fiction. So participants who reported that they prefer reading fiction and read more time, there was a correlation between their empathy levels and time spent reading. The mean scores is also shown on the graph. I'm going to talk about the implications behind the findings of our study. What we found is that there is no statistically significant differences in empathy, well-being, and prosocial behavior scores after the intervention, which means that we cannot say that reading can affect these qualities after a period of a week. However, it's important to note that there are some factors that may have affected the results. The study was carried out during the holiday season, which may have affected the participant recruitment and dropouts. But this is something that future studies can investigate over a longer period of time and with a large sample size. Regarding the correlational findings based on the participants' reports of their daily reading habits, as I've mentioned, there is strong correlation between well-being scores among participants who reported that they prefer reading fiction, which may suggest that reading fiction may have a positive impact on well-being. However, it is important to cautiously evaluate the conclusions about the correlational finding, as it does not necessarily mean that reading fiction causes increased well-being. It may be the case that people with higher well-being gravitate towards fiction over other genres. But this is something that further studies can explore and investigate further whether reading fiction improves well-being. If such a relationship exists, it could have very important implications for professionals working in emotionally demanding settings, such as psychotherapists and healthcare providers. As I've mentioned, self-care is a critical element and an ethical guideline for professionals such as psychotherapists. And if reading fiction can improve well-being, this can inform therapists and other professionals that it may be beneficial to use this as a way to de-stress and improve personal well-being. As I've mentioned, there is a significant correlation between time spent reading and average empathy scores among participants who reported that they read daily. And this correlation was even more prominent with participants who reported that they prefer fiction. It is important to evaluate these findings cautiously, because it may be the case that people with higher empathy levels simply prefer fiction and prefer to read more time, and it might not necessarily be the other way around. However, this is something that future studies can investigate and find if there is a causal connection between reading fiction and empathy, because if such a connection is found, this can have very significant implications for therapists and health professionals. They can find it beneficial to read fiction as a way to enhance their empathy, and they might find it encouraging that their habits, such as reading, may be beneficial not only for their well-being but also for the benefit of their clients and patients, since empathy is such an important component of therapy and a strong predictor of therapeutic outcomes. Thank you for watching and listening. If you have any questions or comments, please feel free to type them and I will answer them as soon as possible.